Good morning, everyone. Thank you for joining us today. It's 11 o'clock, so we'll go ahead and get started with today's Rock County Public Health Department media briefing. We are live streaming this media briefing on our Rock County Public Health Department Facebook page, and afterwards the recordings will be available on our Facebook page and our YouTube channel. So I'm Jessica Turner. I'm the Communication Specialist for the Rock County Public Health Department, and joining us today we have Nick Zupan, epidemiologist, and Katrina Harwood, our health officer. We'll run through some updates and some information, and then we'll turn it over to our media partners for questions. I'm going to pass it over to Nick for some data updates.
Thanks, Jessica. So just to give a little brief overview of the data that we're seeing most recently, we have had 14,948 Rock County residents test positive for COVID-19. And we've had about 160 additional cases since last week when we did the briefing. So we're seeing a slight uptick in our case activity. We're averaging about 24 new cases over the last 7 days. So that's 24 cases per day. And this is a little bit higher. Right now we're looking at about 250 active cases in Rock County. There have been 165 deaths due to COVID. And most recently, there have been 8 patients in the hospital getting treatment for COVID. So the hospitalized patient numbers do remain low, which is good news, despite some uptick in case activity generally. Our vaccine efforts continue to plug along. We have over 49,000 Rock County residents who have gotten at least that first dose of the vaccine, which is about 30% of the total population. And we have about 32,000 residents who have gotten the full vaccine series. So that's about 20% of our total population. In terms of our 65 and older population, we've got over 3/4 of that population have gotten at least the first dose. And about 65% of the 65 and older population have gotten the full immunization series for COVID-19. And just wanted to reiterate something that we talked about last week. The B.1.1.7 variant has been identified in Rock County among a positive case. So that just indicates that the B.1.1.7 variant could be circulating in our community. And that gives us a little bit of additional cause for concern because this variant is more contagious, and so it can spread more easily in the population. The good news is that we know that the vaccine does provide some protection against the B.1.1.7 variant. So we're continuing to ask people to get vaccinated, wear your masks, and continue practicing social distancing as we move along here. So with that, I don't have any more updates, so I'm going to turn it back over to you, Jessica.
Thank you, Nick. I will now turn to Katrina for some additional updates and information.
Thank you, Jessica. On Monday, all Wisconsin residents became eligible to receive the vaccine, which is very good news, especially as we know that the vaccine is one of the ways out of the pandemic. We know that a lot of people are looking for information on where to receive the vaccine, and we're happy to let everyone know that rockcountyshot.com website went live on April 1st and features up-to-date, reliable content about getting the COVID-19 vaccine in Rock County. This one-stop shop resource is created in partnership and funded by United Way's COVID-19 Action Fund and was the result of a collaborative effort of many partners across the county to get this information out to everyone. With warmer weather, we encourage everyone to spend some time outdoors. Luckily, outdoors is where COVID-19 spread is less likely to occur. When at home, we do also recommend opening windows, especially if anyone in your household has been exposed or if you have guests at home. Ventilation, such as through open windows, does reduce the risk that the virus will spread. Also, we ask that everyone continue to wear masks if you are indoors with non-household members. As Nick mentioned, with the more contagious new variant, it's important to continue following all prevention guidance, such as wearing a mask, washing your hands, keeping your distance, and avoiding crowds, even if you're vaccinated at this time. We also want to make sure everyone has a safe summer. There are many ways to make summer events more safe. We do recommend to keep events outdoors if possible, or in well-ventilated spaces indoors if outdoors is not possible. We recommend limiting participants to ensure social distancing can be accomplished. If you're organizing a larger event, we do ask that you pay attention to our COVID-19 metrics and consider postponing or canceling your event if things take a turn for the worse. Also, cases are down and vaccination rates are rising. We are still in a pandemic, and there are a lot of unknowns right now at this time. If you are hosting an activity or an event, we also recommend that you have materials on hand for proper hand hygiene. These would include soap, water, and disposable towels. If those items are not available, then hand sanitizer is helpful as well. Those are my updates for today, and I'll pass it back to Jessica.
Thank you, Katrina. So we will open it up now to questions from the media. And it looks like today our only media participant is Ashley McCallum from the Janesville Gazette. So Ashley, since you're our only participant, we'll go ahead and unmute you. And we'll keep you unmuted so you can continue to ask questions if you have more than one. Go ahead, Ashley.
Great, sounds good. Thank you, everyone. I understand that the vaccination site at Blackhawk Tech is primarily a state-run venture, but is there anyone at the health department can kind of give us an update on how that site is doing? Have they been able to get more supply to vaccinate more people per day beyond the 200 a day that was the starting point? I guess looking for kind of any general update on how things are going down there.
Thank you, Ashley, for the question. Yes, you are correct. That site is a state-run site, but we are in coordination with the site. We do know that their vaccine allocation has been increasing. I'm unsure what the actual number is of their allocation, but we know that it has been increasing, and it is still planned to increase into May until they reach their maximum capacity for the vaccines they can distribute.
Thank you, Katrina. Ashley, do you have any other questions?
Sure. I was reading some things this morning regarding case activity across the nation, and it looks like Michigan has some of the highest case activity out of, across the country right now. Is there any concern about that spreading down to Wisconsin with it being so geographically close and with travel increasing? Is there any anticipation of travel advisories between here and Michigan, or is that something that you all are kind of monitoring?
Yeah, that is something that we're keeping an eye on in terms of spread elsewhere in the country. One of the things that is happening in Michigan is they're seeing an overwhelming number of new cases that are that B117 variant that I mentioned earlier. So, when we're thinking about spring break travel that may have just concluded for folks in Rock County, we're continuing to monitor the data and seeing if those trends will continue to rise, and that's always a possibility with people traveling to other states where there may be higher spread of the B117 variant and bringing that back to Wisconsin. In terms of travel restrictions or travel guidance, that is something that we're exploring in terms of trying to provide Rock County residents with some additional information of potential places to avoid or areas of concern elsewhere in the country. In terms of the geographic proximity of Michigan to Wisconsin, that's also something that we want to be aware of. And we do make sure we're asking these questions when we're following up with our confirmed cases to see what kind of travel those individuals may have done prior to exposure. So definitely something that we want to keep an eye on and is somewhat giving us cause for concern as cases are on the rise and in Michigan. But right now, thankfully, we're not seeing the same level of spread in Wisconsin that we are in some of our neighboring areas, and something we'll just continue to monitor as time goes on.
Yeah. And related to that, with the interviews and contact tracing that's being done, is there any, I guess, noticeable trends as far as what's being reported back from those who are testing positive right now? Is there any demographic trends or perhaps, I guess, behavioral trends, whether it be, people kind of getting positive cases after travel or things like that? Anything that has been noticed lately?
That is something that we're investigating currently. I can report that we're seeing a slight increase in the number of cases among our 18 to 25-year-old demographic. Early on in the pandemic, we did see a high number of people reporting that they were attending parties or gatherings. As we moved into kind of these crisis standards of contact tracing, we weren't as able to collect that type of detailed information, but as the case numbers have subsided slightly, we're revamping our disease investigation and contact tracing efforts to get more information like that. So as we compile that information, we'll be sharing that out and making sure that if we do see similarities in terms of like parties or gatherings or some kind of travel related spread, we'll make sure we're communicating that and making sure that people are protecting themselves moving forward.
Great. And kind of in that same topic, another trend kind of seen nationwide is a lot more spread between children, especially as schools are becoming more and more open. Are we seeing folks younger than 18 coming up with lots of cases around here? I know for a while it was said that spread in school was kind of rare, but has that changed at all over time?
We're still seeing low levels of cases among kind of our 4 to 18-year-olds in Rock County. There has been a slight increase in the number of cases in that age group. For the most part, we are still not seeing case spread within the school setting or during the school day. If there is spread, I think a lot of it is coming from the activities that are taking place outside of that school day. The other kind of variable that we're looking into is the travel. I know that spring break just occurred, and we want to keep an eye on if people travel to other states and potentially, where the variant strain B.1.1.7 is more prevalent, so that we can control the spread of that locally. Right now, it's not like a drastic spike in those cases. It's more like a slight increase that we're seeing across the board, though, in terms of our case activity.
All right, great. Well, I think that's all the questions I have for you all today.
Great. Thank you, Ashley. Thank you for participating. So we will conclude today's briefing. I want to thank everyone who's been watching this briefing today. And just a reminder that these do take place every Thursday at 11 a.m. We do live stream them on our Rock County Public Health Department Facebook page. And if you miss the live stream, you can always catch the recording on our Facebook page or our YouTube channel. If you are a member of the media and you are interested in participating in these live media briefings with the opportunity to ask us questions live, please reach out to me at the email address media.publichealth@co.rock.wi.us, and I can send you the instructions on how to participate in these briefings. So thank you again, everybody. Be safe and be healthy.